Hello, everyone. Thank you so much for being here today. My name is Nandini Ray, and I'm the Senior Manager of Maitri's Outreach Prevention and Policy Advocacy Program. And on behalf of Maitri, I welcome you all. For those new to us, Maitri has been around since 1991, and over the years, it has grown from a small volunteer-run helpline into a lifeline for survivors of domestic violence. We offer free, confidential, and culturally responsive services, everything from legal advocacy and peer counseling to transitional housing, economic empowerment, and mental health support. But our work isn't just about direct services, we also focus on prevention, engaging youth, men, and the larger community through campaigns and education. And we push for policy changes to protect survivors and amplify their voices. Today, we are here to learn about how new federal guidelines might affect public benefits and what Santa Clara County is doing in response. With that, I would like to welcome our guest speakers, Carla Collins, Christina Olague, and Ricardo Romero Morales. Carla Collins is a struggling optimist who sees herself as a progressive feminist bridge for the community she loves and the society we must intentionally work to create so that all are safe and thrive. She has led the Office of Gender-Based Violence Prevention since its inception within the County Executive's Division of Equity and Social Justice. Christina Olague has worked as a community organizer for many years in San Francisco and the Bay Area. She was raised in the Fresno Valley, a farm worker's daughter, and now calls the Bay Area home. She is a new addition to the community engagement team as DESJ. And last but not the least, Ricardo Romero Morales. Ricardo is one of the 3 division managers within the County Executive's Division of Equity and Social Justice. He leads the Language Access Unit and the newly established Community Engagement Team, both working to ensure that all communities can access vital services and information. A proud immigrant from Acapulco, Mexico, he calls San Jose home and is also a lecturer at San Jose State University, where he teaches health advocacy and leadership and management in public health. Now, I am handing over the mic to our presenters. Thank you.
Oh, thank you so much for that introduction. And I'm Carla Collins, and just so incredibly grateful that we're able to be here tonight. I want to thank Zakia and Jaya for making this opportunity possible. It's really meaningful and important, and we appreciate it so much. So I've been at the county for what feels like truly a lifetime, since certainly my adult lifetime, since 2023. And I believe I started working with Maitri in about 2012. And I get to do great work with Shabana, working on our annual conference, and with Rama to make sure that we have services and contracts in place. But this is the first time I'm at a committee meeting like this. And I'm really, really honored and very grateful that I get to be here with 2 of my incredible colleagues from the county exec's office. And so just really quickly for context, we are part of the county executive's office, which has a division of equity and social justice. And within that office, there are some units, probably some that you have also worked with, like the Office of Immigrant Relations or the Office of Women's Policy. And in 2019, when our Board of Supervisors and County Executive started the Office of Gender-Based Violence Prevention as sort of an offshoot of the Office of Women's Policy, I was so honored and proud I've been able to be part of this incredible team. But very grateful to have Ricardo and Christina here. I should have done this. I'm going to start sharing my screen. And I think I'm doing that now. if someone can give me yeah, you see the screen? Yes? Okay, thumbs up, thank you. So let me get right over here. So what are we going to talk about this evening? We have this brief presentation and then lots of time for question and answers because there's so much that's going on right now. No doubt for you, I know absolutely for me, 2025 has been really hard. And to get through this at the county and personally and with the Division of Equity and Social Justice, we know we cannot do this alone. We have to do this with community. And the only thing we know best to do is to share this information with all of you, which is why we're here tonight. So we're going to go over exactly what Nadini was saying. We're going over some things that we're very concerned about that you may or may not know about. If you do, hopefully we'll be able to give you some more information. And if this is new information, that's just as important. We need everyone to know what is happening. So we're going to talk about some federal cuts and really tell you that, in fact, even though these decisions are being made very, in Washington, D.C., right here in Santa Clara County, they're having an impact. And we also want to tell you that we take this very seriously. I am so proud and honored to be part of the county because we are taking a very strong stand saying this is not okay. We have to let people know, and we have to do work on this. So we're going to talk about that and then go over some resources and share some next steps. So what is HR1? Almost everyone I've met doesn't know it by HR1, but really refers to it as, they've heard it as the one big beautiful bill, right? We don't think it's big or beautiful, but that is what it's called. And it's actually not just a bill, it was signed into law on the 4th of July by President Trump of this year. And what it does is really change the way the federal government funds our nation. And it creates tax breaks for the very wealthy, and it's making huge cuts in what we call our safety net, which are Medicaid and food assistance that are most dramatically being cut. And in fact, in Santa Clara County alone, to cover this shift in funding, we're going to see about $1 billion cut starting next year, and we're going to hear more about that. So this is massive. It's not a small thing. It's not a little deal. It's a huge deal, something we have never seen before at this level. And these massive cuts to our funding are really putting healthcare and food assistance in jeopardy, and it's really risking closure of county hospitals and clinics. And you might not use a county hospital or clinic, but you will likely still be impacted by this if you receive healthcare in Santa Clara County. So we want to tell folks about that. Who's going to be the most impacted? That's going to be, first and foremost, our most vulnerable residents. Those are the folks who rely on Medi-Cal for access to healthcare, or might use CalFresh or SNAP benefits to put food on the table. And truly everyone who depends on our hospitals for emergency care are going to be impacted. So programs that are directly funded by Medi-Cal specifically cannot absorb a $1 billion cut on their own. This means it's going to impact all of us, and it means that it's going to take all of us to be addressing this in order for us to get through this time. So I'm going to turn it over now to Christina, who's going to share even more about what the local impacts are going to be.
Good evening, and thank you for inviting us to provide you with a little bit of information about this big, beautiful bill, as Carla mentioned. And as Carla also provided the information that Santa Clara County will lose over $1 billion annually in federal funding that helps pay for healthcare and food assistance. And how that does, how does that look when it comes to healthcare? At least I'll give you a very brief snapshot of what that means. Currently, the county relies on $3.5 billion in federal funding to support critical local healthcare services, like 15 health clinics and 4 county hospitals. Some of you might be familiar, might have even used the services at some of these county hospitals. O'Connor Regional, St. Louis, and Santa Clara Valley Medical Center. And one of the most critical services that's provided at Santa Clara Valley Medical Center is that we are in the Bay Area. We are the only level 1 trauma center and burn center in our region. So we can't afford to lose those types of services. But with the cuts that we're looking at, $1 billion and of impacting the $3.5 billion in annual federal funding that we have been receiving. Yes, we don't want to be too alarmist, but we do run the risk of possible reduction in services, and worst case scenario would be a closure in some of the clinics or hospitals. So again, hopefully none of us ever have to face having to rely on or be a recipient of level 1 trauma care or care at a burn center. But to know that these services are here in Santa Clara County is a great comfort to all of us. So again, thank you, Carla, for that great introduction. And with that, I will hand it off to my colleague, Ricardo, who will give more detail about the impact to food assistance programs here in Santa Clara County. Thank you, Ricardo.
Thank you so much, Christina and Carla, and good evening, everyone. And apologies, my camera just died on me, my battery just died, but I apologize for not being on camera. But I do want to continue this conversation and just highlight the points that Christina had just made about the importance of knowing how this is going to be impacting us. Christina was able to cover about how these budget cuts are going to be impacting us in the healthcare system. And I'm going to talk about a little bit more what this means for the food assistance programs. Here in Santa Clara County, we have more than 133,000 people in our community who rely on federal help to get food on the table. These are people that the large majority are children and seniors. And as we know, when we go somewhere, we don't just show up as children or seniors. What we do know is that we have intersectionality. We have multiple identities. And some of us are seniors with disabilities. Some of us may be children with disabilities or young adults with disabilities. And of course, that is when the most people are going to be impacted, just because this new HR 1 bill, which is the budget bill that's going to cost all of these cuts into our programs, is also asking additional work requirements. Up to today, we're still not very clear on how those work requirements are going to roll out. But what we do know is that they're not realistic. They're not realistic because people who are already older, they may not have the same ability to work as they were before, or they may have a disability that doesn't allow them to work. And perhaps they may not be diagnosed as disabled, but what we do know that sometimes people may have accidents at home, at work, and limits their ability to work. To provide you with an example, my mother actually fell at work about 3 years ago. And while she fell, she broke her arm and her leg. And since then, she hasn't been able to work. And this has been now 3 years. So people like my mom, of course, there are many people out there who could definitely not, this is not realistic for them to be able to prove that they're working. Now, this is also going to be impacting our community because many of our community members, especially those individuals who are survivors, do rely heavily on services that are provided by our safety net. Those services that are essential for us to continue on our day-to-day lives, to be able to go out, try to recover our own lives, look for a job, go to school, attend meetings, all of that. And if we don't have food, then we're not able to function. So this is the magnitude of the impacts that these cuts are going to have in our community. Next slide, please. Now, you might be wondering, yes, this is going to be impacting us tremendously. So what is the county doing? How is local government helping us? What we're doing right now, the county is currently planning. And what we do know during this planning process is that we're anticipating, as Carla and Christina mentioned, a loss of about $1 billion per year starting next year. And I know $1 billion sounds like a big number, but just to provide kind of more of a picture to that, if I were to give you all $1 for each second, it will take me 31.7 years to get to 1 billion. So that is a lot of money, and that is a lot of money that we're going to be losing. So the county has been thinking and strategizing in terms of trying to come up with ways to mitigate these cuts. And the first one is that we as a county are committed to continuing to protect the core safety net services, which are health and food. We're also seeking and partnering up with leaders from across the entire state. And this includes, of course, our very own governor, the state itself. We also have regional elected officials and leaders across the Bay Area, and then even locally here in our county of Santa Clara. Across our cities, we have, of course, local officials, we have elected officials as well, and we have a lot of community organizations that are ready to partner up with us, to continue to work with us, to be able to mitigate as much as possible these cuts that are going to be impacting our community. What we're asking from our community is support through local revenue solutions. What does that mean? Well, our board of supervisors last month, unanimously, they voted to add a measure into the ballot for the special elections that are happening on November 4th. So just around the corner. This measure, it is called Measure A, and it is a sales tax measure that increases 5/8 of a cent in terms of tax. If it passes, it will generate about $333 million to be able to help us. Now, $333 million is a very small fraction to $1 billion per year. So even if this Measure A passes on the November 4 election, we still need to continue to think about what else can we do. So therefore, the County of Santa Clara is also going to have to look at the services we provide. We're going to have to reduce some of the services. And what we don't want to get to is where we have to close hospitals or clinics, because we know that that's where our community is going to be more impacted. Because if you were to have a car accident, that I am not wishing that upon anybody at all or any of our loved ones, but if that happens within our county borders, it is likely that the ambulance is going to take you to a county hospital, regardless of the medical insurance that you have. And if we don't have a hospital, time is of essence. And 5 minutes could make a huge difference between somebody's life. So therefore, this is what the county is doing right now. That is why our own leadership, our board of supervisors have decided, and they really thought this through, because it wasn't lightly. If anything, they have been very vocal and saying, we didn't want to come this way. Sales tax is the last thing that we want to go with. But unfortunately, as a county entity, as a governmental entity, that is one of the only choices that we have in order to be able to help to protect our safety net service. What we're also doing is educating our community around the impacts of HR1. We're going around different groups, different networks to educate the community about this impact, just because we want them to be ready. We want them to have this knowledge that there are changes coming. We may not know today what those changes may look like specifically into the services, but they're coming, and what we need you to do is to be alert so you know exactly when to renew your Medi-Cal if you are following Medi-Cal, or who are going to be impacted, what those work requirements may look like. So you can be ready, and you can also share this information with your loved ones. Next slide, please. And unfortunately, this is a new reality. This is a new reality that we all are facing. This really, to be honest with you, this really stinks because it's just so ugly. It is at a time where we're seeing prices at the grocery store skyrocket. We are seeing gas prices continue to increase. There are very little resources available at this point. And now we have an additional tremendous cut that the county is facing. And as I mentioned earlier, even if the temporary sales tax measure passes, we as a county will still have to make hundreds of millions of dollars in services cuts to address the 1 billion shortfall that we have. What we do know today is that without the revenue solutions, community service that keep our community going, that keep our community healthy, vibrant, safe, could definitely face severe reductions or even loss of services. With that, I know that this information is hard to hear. And even myself, as a presenter, it is difficult to share this information because typically this is not what we want to share. We want to share resources, we want to share services, because as public servants, we're here to help and to provide a pathway forward. And right now, what we're saying is the opposite. But thank you for listening, and I'll go to the next slide. And I believe this is back to Christina.
Hi, thank you, Ricardo, for all of that. And yes, the fact that you're here present in at this meeting says that you are people that are very engaged, that you're interested in what's going on in your community. So what can you do? Well, we do have the HR1 fact sheet, which is a big, beautiful bill fact sheet. Knowledge is power. And right in the little corner here, you see the QR code, and we would encourage you to take a picture of that, and it takes you directly to the County of Santa Clara's website where you can have access to more information and also download some of these flyers. We do have, if I don't want to make any assumptions, but we do have multiple languages available also. Some, I'm not sure, Ricardo would know better than I, but I'm not sure that all of them are available online on our website. But we do have Hindi available. We have Vietnamese, Chinese, Tigrinya, Amharic, Korean, Tagalog, English, Spanish, and I think I'm missing one because I do know we have 10 languages. But if you do have any community members, friends who you would like to educate about this, who are more comfortable reading about this in their native language or in a different language, we do have those fact sheets available in multiple languages. Also, if you have networks of people, could be through your job or other organizations, religious groups that you might belong to, like I said, friends, whatever, neighbors. If you're interested in having someone come and speak to any of those people in your network, please let Carla know, let Maitri know, and we will be there. One of us or all of us will be there to present. And then finally, Ricardo did give some detail about what's coming up at the special election on November 4th. So we encourage all of you to either update your registration status, register to vote, stay involved, stay registered. And I'm just so grateful to you all for being here because it will take all of us as a community to support each other through all of these potential cuts to our safety net. So with that, I will turn it back to Carla.
Thank you so much, Christina. Thank you so much, Ricardo, too, for this is pretty much our presentation. I just wanted to add a couple things. One of them is we have the flyers available in Hindi because of Maitri. Maitri said,
yes,
this is what we need, and along with the English versions. And so we're in process of dropping off actual flyers at the office there, but also have it electronically. And I do think it's on the website. If not, we can get that to you all too, because it matters. It really does matter. And the other thing I meant to say, there's just so much in HR 1, so much that removes, we believe in the dignity and the health and the safety of every resident. This bill does everything possible to take that away. And one of the things it does is single out survivors of gender-based violence. Survivors of gender-based violence, human trafficking survivors, would regularly automatically have access to food assistance. But with this bill, there are line items that say that is no longer, that category is no longer eligible. And starting, some states have already started it by October 1st nationally. It will be the law. So it's just, I think, as Ricardo was talking about, just sort of new levels of cruelty. And it's the law that we have to work to change, and also work to make sure that people don't suffer. And so when we think of all the incredible work that our partners like Maitri do in the community, and what a resource you are in the community, it is just unimaginable to me that some of these laws are in effect, and are, this year we are actually looking at a $500 million cuts, and for next year, when it goes full cycle, that's when we're looking at $1 million.
Thank you, Carla, Ricardo, and Christina, for your great presentation and providing such important information. And thank you so much to all our attendees for attending the event and asking thoughtful questions.